I am Jodiclear Iscania Dinopo presenting Health Promotion. Health promotion is the process of giving people to increase control over and improve their health. Health is a science as a resource for everyday life, not the object of life. Health promotion is not just the responsibility of the health sector, but goes beyond healthy lifestyle to well-being. The fundamental condition and the results needed for good health, peace, shelter, education, food, incomes, and a stable ecosystem, sustainable resources, and social justice and equality. Health promotion is important. For being health should be part of your every overall lifestyle. Living a healthy lifestyle can help prevent chronic disease and long-term illness. Feel good about yourself and take care of your health are important for yourself and self-image. Maintain a healthy lifestyle by doing what is right for your body. Next slide. 3 basic strategies for health promotion. The Ottawa Character identifies the 3 basic strategies for health promotion. 1. Advocate. Good health is a major resource for social, economics, and personal development, and an important dimension of a quality of life. Political, economic, social, cultural, environment, behavioral, and biological factors can allow, favor, or harm health. Health promotion aims to make their condition and favorable through advocacy of health. Health advocacy refers to individual and or group action intended unless they are able to control those things that determine their health. This must apply equally to men and women. Immediate, the prerequisite and prospect for health cannot be ensured by the health sector alone. Health promotion demands coordinated action by all concerned, include government, health and other social and economic sector, non-government and voluntary organization, local authorities, industry, enabled to achieve a quality and health treatment. Establish that all people and in the context of workplace, all workers have the right to receive the same treatment and not to be discriminated against on the basis on criteria such as age and disability, nationality, race, and religion. You need to be equal. Mediate in health promotion. Medication is to process through which is different interests, personal, social, economics, and different sector, public and private, are reconciled all ways that promote, protect health. Commitment to the health promotion. Move into arena of health, public policy, and advocate on clear political commitment to health and equality into all sectors. Counteract the pressure toward the harmful product resource depletion, unhealthy living condition, environment, and a bad nutrition, and focus attention on a public health issue such as a population, occupational hazard, housing, and settlement. Response to the health gap within between a society and tackles inequalities in health product by the rules and practice of this society. Acknowledge people as a maintaining health source to support, enable them to keep themselves, their families, friends, health, and through financial and other means, and accept the community as a essential voice in matter of its health, living condition, and well-being. Routine health. Respond to the health gap within and between society to tackle the inequalities in health produced by the rules and practice of these societies. Acknowledge people as a main health resource to support, enable them to keep themselves, their families and friends, health through financial and other means, and accept the community as essential voice in matter of its health, living condition, and well-being. Reorient health service and their resource toward the promotion of health in shared power with other sector discipline and with people. Recognize health and its maintenance as a major social investment and challenge and address the overall ecological issue of our way of living.
Kim Diwakil reporting. The disease prevention differs from health promotion because it focuses on specific effort aimed at reducing the development and severity of chronic disease and other modalities. Wellness is related to health promotion and disease prevention. Wellness is described as an attitude and active decision made by an individual that contribute to positive health behaviors and outcomes. Health promotion and disease prevention programs often address social determination of health, which influence modifiable risk behavior. Social determinants of health are the economic, social, cultural, and political condition in which people are born, grow, and live that affect health status. Modifiable risk behavior includes, for example, tobacco use, poor eating habits, and lack of physical activity which contribute to the development of chronic disease. Disease prevention is what like a preventive measure to reduce the chance of having serious diseases, like chronic and acute condition. Actually, health promotion and health prevention is somewhat the same on how to address the particular health issue by creating awareness through communication and empowering knowledge and behavior through education and policy, system, and rules. but differs on the terminologies of how it influences the health behavior of individuals by creating such programs like drug symposium, breastfeeding, and etc. Prevention deals with the action to reduce or eliminate exposure to the risk that might increase and to the chances that an individual or a group will incur the disease or illness. Nursing must expand its effort to design and implement intervention approaches into prevention that should be comprehensive, encompass primary, secondary, tertiary, and quaternary levels of prevention and involves consumer in their formulation. Prevention strategies are more likely adopted by the citizen who participate in influencing and developing the strategies. For classification of preventing it. Primary prevention, intervening before health effects occur soon. Secondary prevention, screening to identify disease in the earliest. Tertiary prevention, managing disease post-diagnosis to slow or stop. Quaternary prevention, action taken to identify patients at risk of over-medication. The primary refers on our action to avoid the chances of having the disease. It may make up to improve health through changing our customary in our personal hygiene or diets. Secondary is all about the early detection of disease which may result in improvement of health outcomes. Like it encompasses as an evidence and population-based screening programs include a mass testing, a screening test for early detection. Tertiary prevention is a service that promotes better health quality of life for those who have disease. It includes rehabilitation for those drug addicts, disease programs like cancer patients that they have their own establishment. Quaternary prevention, this involves on the over-medicalization of patient and when a medicine has no benefit for the patient.
Once again, good morning to the students of North Valley College Foundation Incorporated. I am Mary Joy Alyaldama and I will be reporting about health maintenance. So what is health maintenance? Health maintenance is defined in many ways. First, it refers to activities that preserve an individual's present state of health and that prevent disease or injury occurrence. Second, it is a behavior directed towards maintaining a current level of health. Third, it is an activities an individual performs to maintain or improve a current level of health. So there are three characteristics of health maintenance: the perception, motivation, and maintenance. Health maintenance also focuses on known potential health risks and seeks to prevent them or identify them early so that intervention can occur. So there are risk factors in health maintenance that increase the vulnerability of an individual to disease or injury. The risk factors include physical, environmental, and psychological behaviors. So health maintenance have different examples of activities to avoid those. As you can see on the screen, there are three different activities of health maintenance. First, the screening. Second, the health education or counseling. And third is the immunization. So what is screening? Screening is an active detection of disease in apparently asymptomatic, means there is no symptoms, individuals by application of tests, examinations, or other procedures which can be applied rapidly. The aim of screening is for the early detection of the disease that can be better controlled if detected early in apparently healthy individuals. So there are different types of screening: the mass screening, multiple or multiphasic screening, and prescriptive screening. So mass screening is the screening of the whole population. Multiple or multiphasic screening is the use of a variety of screening tests on the same occasion. And the last screening is for early detection of disease in apparently healthy individuals, which can be better controlled if it is detected early. Now, we will proceed to the second example activity of health maintenance, which is the health education and counseling. Health education and counseling provides learning that will help patients manage their disease using available health, social, and economic resources. Patients need to develop their own understanding of the problem and what can be done about it. So, in health education and counseling will include common diet therapies, water imbalance, not to be dehydrated or too much water, functions of nutrients, forms of alternative medicines like the herbs and yoga, sleep patterns, and physical activities and nutrition management behaviors. The last activity would be the immunization. So, immunization has been mentioned a lot during our previous topics. So, immunization is a process by which a person becomes protected against a disease through vaccination. There are different kinds of immunization. Some are influenza, pneumococcal vaccine, and tetanus. So, influenza are vaccines usually administered in October or November. These are antibodies in 2 to 3 weeks. Next is pneumococcal vaccine provides protection for up to 8 years. It only needs to be given once or twice. Next is the tetanus, and immunity wanes 10 years after vaccination and booster every 10 years. That will be all for health maintenance. Once again, I am Mary Joy Alialdama.
Good morning, students of North Valley College. This is Catherine Garfield, and today I will be reporting about curative. Curative care is a different kind of medical treatment or therapies which is provided to cure some specific illness and improve or eliminate a symptom which a patient is experiencing.
Curative care can be provided through different approaches, but all of them have the same goal. Aggressive care is a form of curative care, which is a proactive medical care treatment which aims to eliminate some specific medical cure rather than just minimize the impact of the problem.
Curative care involves treatment intended to alleviate some symptoms or cure a current medical condition. It tries to reduce pain, improve function, and help improve the quality of life for patients. Nurses provide and coordinate curative care for patients in various environments. They set up plans for the care of patients, carry out medical treatments, observe patients, and discuss conditions with doctors and other medical staff. They also assist with diagnostic testing and evaluating results. Nurses perform an important role in instructing patients and families in how to manage their medical condition and explain home care and follow-up treatment. In curative, of course, it is very important to ask questions to your doctor. Those questions includes, do I really need this test, treatment, or procedure? The second one is, what do you expect the benefits to be? The third one is, what are the risks? The fourth one, are there simpler, safer options? Of course, we have what happens if I don't do anything? And the number 6 question, of course, we have how much will it cost? And of course, how will it affect the quality of my life and ability to do the things I like to do? It is very important for you as a patient to ask those kind of questions so that you are aware of what you're going through. So the next thing that I will be talking about curative is when it is appropriate. So with curative care comes hope. Typically, when a patient receives curative care, it is an indication that there is a belief that the patient may potentially recover or will at least be able to continue living at a responsible quality. When it is no longer appears that the patient has a legitimate chance to recover or continue to live with a decent quality of life, doctors may suggest ending aggressive care. While this may sound like giving up on the patient, Such a decision is actually made with the patient's best interest in mind. Once a patient reaches a point where curative care is no longer helpful or effective, the quality of life decreases. At this point, patients may prefer to go peacefully rather than continue the fight. For some patients and families, the decision to end aggressive care is a relief. Somehow, for others, the idea of giving up on a cure is upsetting or frightening. Many hospitals offer counseling and support to help families make the decision to end curative care. Curative care includes antibiotics for bacterial infections, chemotherapy or radiation therapy for cancer, cast for a broken bone, dialysis treatment for kidney failure, surgery for appendicitis, acupuncture for certain conditions, and of course the dietary program for certain conditions. So once again, this is Kat Pinol-Garfield reporting.
Good day, student of Northval College, and I am Anilov Garote, and I'll be reporting about rehabilitative. Rehabilitative, helping to restore to good condition or reconstructive surgery called rehabilitative exercise. Physical medicine or rehabilitation, also known as physiatry, is a branch of medicine that aims to enhance and restore functional ability and quality of life to people with a physical impairment of disabilities. This can include conditions such as spinal cord injuries, brain injuries, stroke, as well as pain of disability due to muscle, ligaments of nerve damage. A physical having completed training in this field may be referred to as a physiatrist. Approach. The rehabilitative approach is described by Trombley in 2002 as aiming at making people independent as possible in spite of any residual and impairment. By page 13, as such consists mainly of environmental adaptation and compensatory strategies. Intervention. Rehabilitative interventions are both non-pharmacological and non-surgical treatment used by therapists in clinical practice to help maintain or regain a person a maximum self-sufficiency and function, to put back in good condition, establish on a firm, sound basis, and rehabilitate and defined as a restore or bring back into a good condition. An example of rehabilitation is to nurse is a see getting back to health, to restore to a good health or use full life as through therapy and education.